It is February 10th, 2021. I want to welcome you into Coronavirus Inside the Arizona Numbers, where we take a closer look at the numbers coming out of the state of Arizona. And we've been delighted to offer more good news lately as we lower some of these numbers and raise one important number, and that's the number of vaccines that are happening. And we've just received word that we have passed the 1 million mark for doses given out here in the state of Arizona. We'll help you understand how that all breaks down and how many people that actually affects as we make our way through some of these numbers this afternoon. But we want to thank all of you for joining us. I'm Katie Rammel. Alongside me here, Garrett Archer. Be sure to post your questions in the comments, and we will try to answer them as best we can. A lot of big talkers today, and we'll get through all of those as well. In the meantime, though, we start where we always do, Garrett, on that summary page today.
Yes, absolutely. So this is what we got today. Number of new cases reported, 1,977. Fairly low number. And the number of deaths, 176. Fairly high number. So what does that do to our numbers, our statistics? We're at about right now a 28% decrease week over week as far as our 7-day averages. Our 7-day average is slightly down today at 3123. It was 3170 yesterday. So pretty much level, but slightly down. And the number of deaths, the average for the number of deaths is now down to 126. It was 132 yesterday. Hopefully we will see this number fall for the rest of the week. But really, it's going to depend, of course, since it is a 7-day average, as to what happens over the next couple of days. Are we still going to have triple-digit death reports? We're expecting at some point very soon to stop having triple-digit death reports. We don't know if it's going to come this week. We don't know if it's going to come next week, but it should be coming shortly, just based on the lowering numbers that we've seen in not just the cases, but also the hospitalizations in ICU.
Yeah, a key indicator in all that. And we'll talk about some of those hospitalization numbers in the meantime. So that puts us at 14,462 lives lost here in the state of Arizona, 8,209 specifically in Maricopa County. So pretty high marker number there that we're passing just for one county. Garrett, as we look at some of these numbers, this is not the only dashboard that we want to highlight that has been recently added to this chart here from AZDHS. And that's a vaccine dashboard that they've made that's been incredibly helpful in helping us to understand how we've gone from, now keep in mind, December 14th is when the vaccine rollout started here in Arizona. We're not even to February 14th yet, and we've been able to accomplish 1 million doses here. That breaks out to two different numbers that you want to track. First of all, people who've gotten their first dose, obviously that's much higher, 3 times the size of the number of people who have had their complete dose set. So both shots. That's about 208,000 so far. And I see you reloading there, Garrett, to bring us to that.
This was an older dashboard.
There it is on the top.
I have a lot of browser tabs up at all times. So at first I was like, oh, where did it go? And I'm like, I bet I just have to reload.
Tucked away. We'll help you pull it up there again.
Yes,
this is the most helpful spot, and I want to show all of you, and we'll go over it with Garrett, but we will not be here with you for the next couple days, so because we're on other assignments, so we want to make sure that you have the tools to track this information as well, and they've added it on the front-facing page of AZDHS when you click on COVID data, and it brings us to this chart. It really helps. So Garrett, walk us through what we should interpret from this.
So what we have right now is we're looking at this, and I'm just going to do as a side comment. I'm looking at some of the comments, and there's a gentleman on there that's sitting there saying, please stop believing this nonsense. And it's like, dude, we're giving you good news right now. So either pay attention or just stop commenting, because you're literally not adding anything.
Hey,
anyway.
You know what? Every comment that's on there, though, Garrett, pushes this algorithm out to more people. So let's consider it's helping to spread the message. So I guess thanks for the comments in that sense.
Thank you for the comment. Thank you so much. Okay. So anyway.
Okay. I will note too. I got a pen here. I'm jotting down some of the questions so that we can get back to them. Doug, I see your question. Carrie, I see your question. And we did some research for you. She's been over on my Facebook page asking. So we'll get to all of those answers as well. But first of all, with this vaccine page, what can we gather from this? A lot of data there.
Yes, this is again, we've talked about this is a brand new dashboard just released yesterday. Now, the governor just tweeted today that we reached 1 million vaccines. He tweeted about an hour or two or three after this dashboard was released today or updated. So I obviously you can see we were only about 3,000 vaccines doses off. So that makes complete sense that someone over the AZDHS tweeted to the or sent a message over to the governor's people that they had gotten to 1 million. So 996,699 total number of COVID-19 vaccine doses. 777,000 people in Arizona, so about 10% of Arizona, now has at least one dose. Okay. Now, the fully complete, that's 208,000. So about, what is that? About 2%, 3% of Arizona is fully vaccinated against COVID-19. And this is the total number of doses ordered, which is 1.2 million. So you can see we have about 200,000 vaccines that they've got in storage that they're putting out in the next couple of days. So that's what we're looking at. This right here is the number of doses administered on any given day, and you can see this is one where we see there's obviously a weekly trend. They're not doing as many doses, or at least not reporting as many doses on weekends, but it does go up, and we want to see this weekly trend continue upwards. Obviously, you do not want to see this go down for quite some time, because we have a situation. In fact, what I would say is, now that we can track this, if we ever start to see it level off or go down, then really the counties need to start thinking about moving into the next phase. So because this should continue to surge forward while it's in a certain phase, and if it starts to lag, then we should start thinking about moving to the next phase and opening up to a larger population. This gray line is the total cumulative vaccination number. You can see there's a different graph here, or different axis here, so that this doesn't get carried away and get too high compared to everything else. And then we have some ethnicity data here. You can see that most of the vaccines right now have been administered to those that are, they put down white. That's about 48%. 36% of the vaccines are for people who identify, other race unknown is likely not an identification. It is the lack of an identification. So this is people who the data when it came in didn't have any sort of ethnicity to it, and so they're parsing the data. One of the two things. So they're working through that. That number should slowly become less and less over time, since now we know that they're collecting this data. Hispanic or Latino, 63,558. About 8.2%. American Indian, 23,000. Asian, 18,000. Black African American, 11,223. Native Hawaiian or other Pacific Islander, 1,772. So that's what the ethnicity data looks like. Obviously, the vast majority of vaccines are going to 65 and older, as that is the phase of the general population that it is open to at this point. And so the majority of, say, 20 to 44 vaccines, this is going to be healthcare workers and education and childcare workers along with this as well. That's where you have these. This is general population. This is the sort of the phase 1As. And then we can look at this by state POD, which is the state sites. And we can also look at this by county. So we can go through each county to see what's going on there. And again, with the same thing I just said, when we look at a county and it starts to sort of slow down, like here's a good one right here. This is Pinal County. You can see that there's actually some indication here that they're actually going to start slowing down on the number of doses that they're administering on any given day. So that again is an indication that they may want to consider moving to the next phase at some point soon. Simply because obviously your population is starting to max out if you're starting to deliver less doses.
Yeah, it's interesting. It would be interesting to know even more about how they track this, because if it's a slowdown in people registering for the vaccination, or a slowdown at the site, but having ways to know when interest has leveled off a little bit, so that they can indeed open that up to another group. I'll tell you where interest is gaining quickly, and that is Pima County at U of A. The governor also just announcing a few moments ago that they will open up a vaccination site on the University Mall area right there to try to push vaccinations. And we'd heard rumblings of this. We've talked about it on here, sharing that with some of you, and no further details were given. But tucked under the governor's announcement of that 1 millionth dose given out was also the opening of this site at U of A and for those in Pima County. So we'll keep you updated on the information specifically to come out of that area. But then we might even see some of the numbers pop there if they're trying to get make sure that that site has got a lot of doses. Okay, so Garrett, you know, we kind of talked about this yesterday. We don't need to spend a ton of time on it, but just to remind everybody, this is not really a sampling of the general population because it's only open to those groups. So really the only one that you can sort of compare for a general population number is that 65 and older group in the set areas where they're accepting that age group at this point. But this is important, though, and it will continue to be important for measuring how equitable the doses are if they're reaching all communities here in Arizona in an equitable way, and also to identify any hesitancy in taking the vaccine. So that can be work to create understanding within those communities that might feel a little hesitancy. So really,
what we need to point out, of course, is the two things, and I think I may have pointed this out yesterday, but remember that when we talk about vaccine equitable distribution, our two issues that we have right now are well, we have two issues. One is that other race unknown is 37% of the sample data set. That is a massive percent of a hole, if you will, in the data. That basically means that there is a fairly large margin of error to the rest of these numbers. Even though, like, say, for example, Hispanic or Latino in that number says 8.2% of the vaccines have gone to Hispanic or Latino, with 37% of the data having an other race unknown marking on it, that 8.2% could be as high as 15, 16%. We just don't know. So that's something that we have to just understand when we read this data, that is a possibility. The other, of course, to at least remember is that Arizona is a state in which the older the demographics get, the more white the demographics get. So the Hispanic population in Arizona is fairly young. And so, like, if you go up into that 85 plus, it's very, very predominantly white. And so right now, the people who are, the demographics, if you will, of that 65 and older does skew more white than the demographics as a whole in Arizona. And that is right now the demographic group that is eligible to get the vaccine. So as we move into different phases, obviously this changes, and it changes the calculation, and it changes how we look at vaccine equitable distribution.
Yeah, it's either way, it's great that they're continuing to make these considerations as well. And you're right, the nuances need to be considered there. Let's talk about an interesting phenomenon. I don't know if any of you got to catch Jimmy Kimmel last night. He was kind of poking fun at it. It's a story that's come out more and more. But this idea, Garrett, of vaccine hunters out there, and he kind of made a joke of it because he had people putting on a paper nurse's hat and a little kid's firefighter hat, and they were saying like, "Let me get my vaccine. I'm a firefighter. I'm a nurse," and making a joke of something that has actually become quite serious, and that is people out there really working to spread information, kind of as we are, to help you find the vaccine and find more information about it. But there's actually a whole site now dedicated to this, vaccinehunters.org.
Oh my gosh.
And it helps people who are out there searching for a vaccine find any standby lists, teaches you where to call to get in touch with local providers, find out when a closing time is, and see if they have any sort of protocols for vaccines that might be open. Remember, they have to be spent, depending on the manufacturer's instructions, anywhere from 5 hours to 24 hours after being pulled out of that freezer. They even have a whole Reddit group to be able to share information about what works. And this is keenly important because, remember, this vaccine sign-up situation has been maybe a little bit favored to those who are tech savvy. So you do have to sign up through a computer system. You do have to have internet access. You do have to have all these things and understand these systems. And that's why it's been so important, if any of you are able to go help older people in your life who are maybe 75 or 65 and older, who are looking for getting signed up for this and don't necessarily know how. We had one of our reporters, Cameron Pullum, who helped his dad through the process, and we showed that story of how really, if you are tech savvy, you really have something to offer maybe your neighbors or friends who are in this older group who are not, and you could provide a service to them. Were you pulling up that site just now?
I couldn't find it. It doesn't like it
Oh,
doesn't exist anymore. It's been pulled off the internet.
no, it should still be there. I just checked it a few minutes
Did
ago.
you? Okay, maybe
Oh, I'm sorry. There's no S on it. Vaccinehunter.org. And then their Reddit, for those of you who are on Reddit, so it's r/, and then the word is
there
Vaccine
it is.
Hunters.
Thank you.
For that particular site, but they've got some tips and some other things that you can do if you're out there searching for a vaccine, and or maybe you would like to help someone who's older in your life be able to get it. So anyway,
yeah, I mean, as we've talked about before, and you just said, it's the thing is because of the cold storage nature of this vaccine, there are times when they have to vaccinate people if they're at the end of the day. And they have X amount of vaccines left over. It's either that or you dispose of them. So, I mean, as much as some people might look at this and say it's cutting in line, in reality, until we have a vaccine that is doesn't have these super strict storage requirements, that is a reality of this vaccine.
Yeah, and what we've talked about here before is it better to just get a mass amount of the vaccine out, or get it to these high risk groups and be able to get them vaccinated very quickly, but then end up with some leftover in the vial? And then what do you do with that to set up a working system to make sure that absolutely none goes to waste? Okay, let's get to just a few more numbers here and move on to some of these hospitalization numbers. They're trending down. I mean, that's the good news in all of this. Day over day, week over week, we're seeing things drop. We're so happy to report that. Garrett and I have been with all of you for months and months and months here in the afternoon, and it's good to report better news.
Yes, we do have one milestone we hit today as well, and that is that we're looking right now at the ICU beds. This is the AZDHS graph, and we have finally got to the point again where the ICU COVID-19 763, ICU non-COVID-19 is 809. So we are finally back at the point where the non-COVID-19 ICU patients are now outnumbering the COVID-19 ICU patients. It has been 2 months. 2 months since that has been the case.
Wow. Really good news.
Yeah. So, and you can see, as we've talked about before, and you can see throughout this graph, obviously there's a lot of people out there that need either some sort of elective surgery. I say quote unquote elective surgery because that's technically a lot of these surgeries are not really that elective. And so they're going to keep that headroom pretty high. It's at 88% right now, and they're probably going to keep that high for a while as they get through some of these elective surgeries that they've had to postpone due to the COVID-19 pandemic. And then we'll see what happens in the future. But again, we're still continuing to see dropping numbers in all of these metrics.
Yeah, some really good news across the board. We hope that this is giving our healthcare workers a chance to just at least take a breath for all the hard work that they've been doing for these past couple of months as we try to sort of make it over this hump. One of the things, Garrett, when we have the date of death, we plug it in on an epi curve. So if there's a time period that it needs to be investigated, or there needs to be more information gathered about whether this is actually a COVID death or something else, we have a little bit of time, and then it's plugged in when it's officially ruled a COVID death on the epi curve, and that gives us a specific date. So when we see a number like 176,
like for example, I'll show up my epi curve right now just to show what we're looking.
Because what I'm really interested in now is that we seem to be, I mean, we're still in very high numbers, and we remember every family who's lost someone, but 176 numbers today, and as we plug those back in, how does that epi curve then look? Are we past the highest date of death? And if
we are,
what is it?
It does appear that we are going to remain past the highest date of death. And while this is a great graph, the one disadvantage I have to my epi curve is I can't highlight these data. So I'm going to look at this really quick as well, just by myself on the actual AZDHS website. So that date of death, that is January 18th, 164 deaths. You can see that light blue means that it was just recently added. And actually, you can see light blue was added, pretty far along the curve today. Most of it coming just in the last couple of weeks. But we go down here, you can see 7 deaths were added this last week, just in fact in the last 3 days. And then we had 89 deaths that were added to the curve from basically January 31st to December 6th. But we had deaths added to the curve after investigation all the way to, you can see the week of December 6th. there was a death that was added to the curve. So this is not a uncommon occurrence. We have we frequently see that that deaths are added to the curve over time. Not always this far back, but it's not, again, not uncommon to see things coming back. It could come back a month, maybe 2 months sometimes, but it does happen. This isn't like a one-time deal.
Yeah. So again, what was the highest date that we experienced?
That is January 18th, and it was 164. And it does not appear that we are going to
pass that.
That will likely remain the highest date of death in perpetuity at this point
Right.
for COVID-19. Unless they do massive investigations of death certificates at some point in the far future, after the pandemic is essentially subsided a little bit. That's where we're going to end, right there on the peak day.
So Tiffany is saying that all deaths now are apparently COVID, and there's actually a way for us to show Tiffany how you can find this. There's deaths from everything still, and those death reports are still released in the state of Arizona. We can see year over year numbers.
This is something that has quite literally held on. It is a rumor that's held on since I think June of this last year.
But it's a simple way to dispel these, because we still see the high, or I shouldn't say high, but the average number of deaths year to year, and you can see where that stands. And coincidentally, if you look at the numbers here in Arizona, we're about 15,000 deaths higher than that, and that correlates pretty close with the 14,462 that we've lost. So we're still well within our average, sadly, of deaths from other causes, and those other statistics still remain year to year as they have been, especially here in the state of Arizona, which is the numbers we're focused on it and pulling the information for. So that can be found in multiple different places. And Garrett, you've highlighted that over the months that we've been talking about that here. Julietta asks about the high-risk groups and when they could be seeing vaccinations. Julietta's comment was a little bit back. I hope we can find it. Oh, yep. How do we know when the high-risk groups like chronic asthma patients could be vaccinated? So we still have a little ways to go as we wait through this order of vaccinations, Julietta. Most places are in priority phase 1B or phase 1B. So phase 1C is adults of any age with high risk medical conditions. So we've got a little ways to go to get to 1C. I'm assuming you're in Maricopa County just because most people are on this chat, but let us know if you're somewhere else. I can let you know the differences there. But we haven't even hit full phase 1B in Maricopa County.
And
so
I'm curious as to, and I'm literally just talking because you said that, I'm curious as to how they're going to do that. How they're going to
split up 1C, because that's such a huge.
Yeah, when they're in 1C and people, adults of any medical condition. So how does one prove that? Do you have to will you have to bring a doctor's note?
Right.
Will you just have to check a bunch of check boxes? Because anybody can check boxes. So I'm saying, I'm literally just curious as to how they're going to do that, because there's, if I want the vaccine, I can say, oh yeah, I've got 6 forms of diabetes.
Absolutely.
So
yeah, absolutely, Garrett. It's the same sort of thing they saw in New Jersey. One of the situations there for people who were living in New Jersey, they were saying, we want to let all the smokers come over. Well, people were saying, well, I'll just go buy a pack of cigarettes and show up. Exactly. Do I have to smoke it in front of you? What's the deal here? Yeah. So working through systems of verifying this information is going to be interesting, and also the sheer size of Group 1C. It'll be such a large group of people that it'll be interesting how many different vaccines that we have out at that point. We've been updating you on J&J's vaccine as they're getting closer. February 26th is the date that they are expecting to appear in front of the FDA for consideration. And they're saying that we could see J&J's vaccine out rather quickly after that, already showing up within the month of March. So that alone could change the game quickly. So hopefully that answers your question. I know it's a little bit convoluted, but 1C is the group that you're waiting for, and hopefully we can get there quicker rather than later. Douglas was asking a little bit ago, Douglas, I hope you're still there. Douglas was asking about breaking the numbers of those lives that we've lost down by age group, and we can absolutely do that for you, Douglas. I don't know if it's easier to do that through the Maricopa County data or the Arizona State data, Garrett, whichever is closest to you.
I think we'll use the Maricopa County data only because it gives us a little bit more perspective on the death rather than just the raw numbers. And I think for Douglas, that will be, that's better for everybody than just seeing the raw numbers. So
yeah, and remember, in our state of 7 million, we've got 4.5 million here
yes,
in Maricopa County. So it's a
yes,
pretty good,
it is an absolutely good
solid
statistical sample of
reflection.
the state, solid
Right.
sample of the state. So let's go to risk factors on their dashboard. And this is what we're going to look like here. So we can see, and we haven't been here for a little bit. So let me just kind of go through this again. Pretend there's a line right here between these two bars because these are mutually exclusive to the top. But here we go with COVID-19 cases. You can see the majority of COVID-19 cases, 45% have come from 2044. 65 plus have been 12%. Hospitalized, 44% of COVID cases that are hospitalized are coming from 65 plus. ICU, obviously this trend continues, 52% from 65 plus, and then 75%. So 3/4 of the deaths from COVID-19 have come from 65 plus. Now we look at this as well. Chronic medical condition, you can see 40% of the deaths, so just under half the deaths have come from people who have had some sort of comorbidity, at least one comorbidity. And then the highest risk category, that is people over 65 plus, in reality about over 75 plus, 80 plus, and also have a comorbidity. You're talking about 83% of the deaths. The vast majority of deaths from COVID-19 have come from people who are over 65 and very likely and have a comorbidity. So that's the group that is obviously the highest impacted by this.
Yeah, thank you for addressing that. I had some questions on my Facebook page today
Sure.
about that as well, challenging us about not talking about comorbidities. I'm like, we have talked about it all year. The good news is we're moving on to some of the other issues, and that being vaccination numbers, but still worth touching on it here today and letting you all know where you can find that in the risk factor
and
breakdown.
when we were talking about those those numbers of so obviously just going back to the vaccines that we're talking about, so it's 83% highest risk, comorbidity is someone who has a comorbidity and is over 65 plus. Well, right now the vaccinations are taking care of most of that group. So
Right.
obviously because 3/4 of the death are coming from 65 plus, and then obviously when you add comorbidities to it, the vast majority of the people who are impacted are people who are both 65 plus and have a comorbidity. We're taking care of that group right now.
Yeah.
And that's sort of going to hopefully really affect the death numbers as time goes on. We're only at 200,000 fully vaccinated. That's one of the things. Yes, we have 1 million doses out. Great. 750 or 70,000 people have been vaccinated with just one, which we all know doesn't actually make you immune to the virus at all. So really, we have to wait for that second number, which will pop. Starting about 3 or 4 weeks, it's going to pop to about where we are.
Yeah, I mean, the executive order that came out to really speed this process was on January 26th. So if we consider how many people have gotten vaccinated just within these last 2 weeks, and then they go back for their second dose in about 3 weeks, provided that that's available to them at that time, then we should really start to see that second number swing at that point. Yeah, good news all around as soon as they can get that handled. Douglas is still with us. He writes, "Thank you. You're so welcome, Douglas. Thank you for joining us, and thank you for the thoughtful question." Kathy's saying, "Thanks for breaking it down." So this is where you guys can find it. This is on the county health department site. And keep in mind, because we have such a strange setup here that other states don't have, where we have this massive populous county, just looking at this county site can be statistically relevant, whereas other situations, other states, that might not be the case if you're watching from somewhere else, because your state might have so many little counties that you don't have the luxury of this disproportionate population to look at. So hopefully that helps. Okay, so the big talker today in all of this was, of course, Fauci and the CDC coming out and saying we'd really encourage double masking when we have these variants that are now popping up. And of course, a lot of people who were already having trouble with the just masking in the first place were like, I'm not ever going to put a second mask on. I have to tell you, at one point I was in a situation where I'm like, this doesn't feel as safe to me, and I did do a second mask. This was a while back, and it wasn't bad at all, actually. I didn't find it to be that much different from just wearing one, but their specific recommendation that has come out is more, I would describe it more as like a surgical mask with a cloth mask over it. Maybe you've seen some healthcare providers doing that, really making sure that there's no gap on the sides, there's no gap on the bridge of your nose,
Yeah,
and those types of things. Make sure
this
it
is
fits
from the
snugly.
CDC website. So this is the sort of infographic that they put out
Mm-hmm.
for this, and this is what they're saying. So in lab tests with dummies, exposure to potentially infectious aerosols, basically people talking and spitting, decreased about 95% when they were both wore tightly fitted masks. So this is cloth mask over medical procedure mask with knotted ear loops and tucked in sides. So that's what they're saying.
Yeah. So if you want to access this is on the CDC's website. You
Yeah,
said,
this is
Garrett.
the actual study that says maximize. Oh, this is maximizing fit for cloth medical masks. Oh, this is the one yeah, I thought this was the one they had with the double mask. I think it does have the double masks on it as well. Yes, it does have it, but I'm not going to go through all of this.
Okay.
So,
No, that's fine.
yeah, it's on here on the CDC website, and it's just brand new, released today. And it's basically talking about maximum fit for cloth and medical procedure masks. In there is where they make the recommendation for the double masking. But yes, I'm certainly not going to bore you with reading all of this.
Well, the main headline in all of that is that providing that extra layer of protection if you have not been able to get the vaccine just yet, with these variants increasing in some areas. Ray's writing, I've been wearing 2 masks since the pandemic with no problems. And I saw Margaret writing, same, Katie, 2 masks really didn't bother me. I mean, if you're putting one on, geez, it really is not that much to ask to put a second one underneath it. I do want to mention, if you are still looking for a mask, Arizona does provide free masks to those who are vulnerable, our vulnerable population. So if you know somebody that needs access to that, azdhs.gov is the site to go to, and they will on the main page have the invitation to get those masks. I want to give you a phone number that you can also call. You could call 211 or 1-844-542-8201. I said that fast. 1-844-542-8201, or again, just call 211, and it's just one of the easiest ways if you're still on a wait to get your vaccine and you have not been exposed to coronavirus yet, don't have those antibodies. So I want to answer Carrie's question. She had asked on my Facebook page, and she also asked here about filters. And what they said about filtered masks, Carrie, is that if you can't do a double mask, a 3-layer with an inner filter would be the second choice to that. So digging deeper into that study, that's the answer that we found for you on there. Carrie writes, thanks, Katie. I ordered some medical masks for my sister-in-law. I'll order some for us. Bless you, Garrett.
You. Sorry,
did you mute your mic when you sneezed?
I did. I knew it was coming, so I muted my mic, and someone was commenting about allergy season, and I'm like, woo, here it comes.
Here I am at Exhibit A, sneeze, and bless you. Okay, so Carrie, hopefully that answers your question. Thanks for the thoughtful question that was on my Facebook page earlier, so we wanted to make sure we got to it. So again, the double masking is what they're recommending, and then the 3-layer with the inner filter if you don't have the opportunity to double mask. All right, Kyrene is going back to school, Garrett, March 16th.
Okay.
We just had that information come in. So some of these schools that have been out since Christmas are now letting some kids come back in, still providing the stay-at-home option, but March 16th is their target date. I've been telling everybody my kid's school has been out for the whole year, except for just a few days that they opened. And as you and I had the luxury of seeing all the numbers here, I could see that the few days weren't going to last. So I'm not going to send them for 4 days just to have school canceled again and all that. So
sorry, I was moving a train of thought. I did want to address one of the comments about how it's been more, and I don't want to call this person out because but they're saying 2 masks. Why? It's been more than a year. If you think you didn't print across the virus, you're lying to yourself. You were doing just fine in 2019. I see this argument. You have to remember, we're now talking about the B117 variant in most cases here, which is about 60 to 70% more transmissible. And that's one of the problems they're having with the cloth masks, is that they don't tightly fit. And if we're talking about aerosol spray, and this thing is way more transmissible, that's one of the reasons why it is different. This is a different recommendation than they had back then, because we're talking about a different variant. And there's many studies out there that are thinking right now that the B117, if it's not already the dominant variant out there, it's shortly going to be the dominant variant. So that's one of the reasons why they make these recommendations, is that this isn't the same situation we were back then. This is a new situation.
Yeah, your past performance, if you will,
Yeah.
and success around this virus is not necessarily continuing to be the case when we see the virus changing into many different types of variants here, and we do have that here in the state of Arizona. So, okay, a few more things. We just have a few more minutes left to get to these. If there's any other questions, we can try to answer some of those as well. But Garrett, when we look at these numbers and we try to gather what's happening here, we're seeing the numbers in hospitalizations drop very quickly. We want to look ahead and see how things look or how they're projected to look here in the state of Arizona. Of course, there are some outlying factors, some anomalies in all this, and that being so many people visiting Arizona from other states, so many snowbirds who are escaping quarantine or being locked up at home in a cold state or in an area where they live in, where the rents are very different and they have to live in New York in a smaller apartment or a little kitchenette, and they're looking at this going, I'm not doing another winter, I'm going to Arizona, and they come out here to remote work or be retired here. So I know that those are some outliers in this, but how do our projections look here for the state of Arizona so far?
Sure. I'm going to look at projections from IHME, and I'm only going to use both the projection and the variant projection. So variant spread. I'm only going to use those two right now. And you can see right now, you can and this is looking at infections. We're going to start there for this particular one. And you can see that the variant spread does impact the line. If you go all the way down to, say, April, you're now in a situation where they believe the projections are going to be about 3,500 Arizonans on any given day are going to be infected by the virus. However, with rapid variant spread, that goes up to about 4,000 per day. Now, this is not the confirmed infections. This is the estimated sort of what it's going to look like. Most of these would be confirmed infections, but not all of them, because there's going to be some cases where they're not confirmed. But you can see it impacting the line fairly quickly. And we saw this, we've talked about with vaccines, how it didn't really change the line all that much because we have to get so many people vaccinated, but the variant spread does have an impact on the line pretty quickly.
Yeah, it does. That's for sure. So this is Arizona specific. If you're watching from somewhere else, that pull down bar will give you more information on the state where you're watching from. I know we don't highlight every other state. You can also look at things globally on here, and for the U.S. overall, I'm assuming that overall it sort of reflects, I should say, across the U.S., it sort of reflects what we're seeing here in the state of Arizona as well.
I would assume so. Let me just change it over to the United States here to see what the difference would be. Obviously, it's much harder to do a projection of the entire country because we are a very large country. And let's see, is it working? Come on, you can do it. It's fighting me. It doesn't want to give me the United States. That's funny. All right, here we go. All right. Here it comes. Yeah, we can see it sort of showing with the same data here, following sort of the same spread as Arizona. It believes that and this is, where are we? Okay, so we're seeing projections. You can see, they're thinking, and I believe this is a per capita, but you can see, this is daily deaths. I'm sorry, my apologies. You can see the variant spread does impact the daily deaths number, pretty quickly as well. And then again, with the daily infections, you can see not only it does expect a small spike in March, and you can see, but the variant spread, again, an immediate impact on the numbers. I'm going to sneeze again, so I'm going to mute my mic.
Oh, okay. We'll let you sneeze. You can mute your mic in the meantime. I want to let everybody know the Suns have just announced they're actually doubling the number of fans that are going to be allowed at games next week. They started out with allowing some healthcare workers in, and they started out capping it at 1,500 fans, sort of getting the situation primed and getting used to having fans back in the stands there. And the Suns now announcing that they will increase capacity to 3,000 fans. They're also introducing a new, what they're calling exclusive party pod, which is available February 16th. So to keep your group a bit safer and enclosed there, they said that it was a successful launch of inviting the 1,500 fans back. And they were doing 2-person and 4-person socially distanced pods. And they've decided to increase that capacity overall to 3,000. So they'll be adding more of those 2- and 4-person pods in the upper level. And then they've got a limited number of floor seat pods. You see why that's a little bit more concerning, because you're closer to providing a risk to the players and the people who are actually in the game without a mask on. So a little bit of a different situation there. But we're seeing that, and it's very Arizona focused right now, Garrett, because we're getting ready to launch spring training, and they've said that there are not going to be fans at spring training practices, and that was a really like involved and romantic situation. I used to go with my grandpa when I was like in 5th grade, and I could go down to the edge and watch baseball. And this was when it was at I'm forgetting the name of the park, Scottsdale Road. Let me think. Hayden and Indian Bend. I forget the name of the park that's right there, right around there.
Not Talking Stick, right?
No. Long before any of that existed. We're talking.
Yeah, no, I'm not going to know that. I'm not long enough to know. Sorry.
You know what's happening to me? I'm forgetting so many like names and places because I literally haven't been anywhere in a year, and I haven't seen people in a year. It's like, what was that guy's name, or what was that person's name? What was her name? And yeah, so I don't know if that's happening to any of you, but I feel like I'm going to need a full reentry. Anyway, so the facilities down there where they used to practice, and you could get super close up to the San Francisco Giants and be really involved. And one of the things the players were encouraged to do is be right there with the fans and signing balls and talking to the kids, and that sort of like intimate setting is now gone, at least for this year. Nothing about Fan Fest happening or any of those other fun events. Of course, we do still have spring training, but it's a little bit more of a traditional feel where you're going to the game and you're back from being into the real life situation there of the game. I'm not thinking it. Producer Carrie saying, is it Hohokam? No, it's not that either. It's a park that they literally like now they would never even have it there because it's like a baseball field. I'm gonna have to look it up and post it on my Facebook page.
Baseball field.
Yeah, I mean, it would never be like, I don't know. Help me if you guys can think of it. I can't even think of it. I can't think of it. This is what's happening. This is what's happening to me. Okay, so I'm telling you, I'm gonna have to do like a full brain reboot. So anyway, so these places are talking about how do we reintroduce fans and how do we get the situation going again. Not Indian Steel Park, Ray, you're too good. No, that's way over. Like Hayden is where I'm thinking, and in Scottsdale.
I'm like,
I mean, we're talking 1987. This is like years ago. Not even Joe Hangemuller. Hello, how are you? Not even Scottsdale Stadium, because that's like where they play now. I'm talking like old school. Like I'm really aging myself now, but they used to literally play in the park and the kids could come right up. So
that's funny.
Anyway, I'm gonna look it up and post it because now it's driving me crazy. Okay, so they're really having to figure out how to introduce these fans and bring them back safely, and it's something that we'll continue to track for you here as we hear of changes being made, just like we saw with the Phoenix Suns. So wanted to keep you updated on that if you're looking for tickets to things. Okay, got a matter of minutes and seconds left, and just want to touch on what you're going to be watching. We're not going to be here with you guys for the next 2 days. I'm sorry to say, Garrett and I are each on assignments. We'll have some other stuff for you and reporting in our newscast, but we won't be here in the chat tomorrow and the next day. And I want to mention that the zip code updates come out tomorrow, Garrett, and reminding everybody where they can find those.
Yeah, so the zip code updates, obviously we don't have time to look at them today, but you can find these. They're going to re-update tomorrow. They haven't been very exciting, but it's getting close to start to flash back to yellow in some places. It's going to happen very soon. If it doesn't happen tomorrow, it could happen the next Thursday. So this is that Maricopa map, the gis.maricopa.gov/COVID/schools. And this one, again, it's been all red for weeks now. But again, we're getting close to starting to see some moderate transmission in some places. We're still, especially in these northern exurbs, right here, 85342. This is very primed to go to yellow at some point. And so there are, we're going to start seeing a different color on the dashboard here soon. So looking forward to seeing that at least begin shortly.
Yeah. And if it is, I'll post it on my Facebook page tomorrow. I'll let you know where you can find me there and I'm sure you'll put it on Twitter too, Garrett. So if we see any yellow on that map, Garrett and I will still be here behind the scenes. So we'll check on that for you. We just won't be here in a broadcast. Hey, Doris, did you just get the vaccine? She's writing, Katie, great news. Husband and I both, you just got the vaccine at Walgreens, 2 blocks from home. Oh, you're the best at keeping us informed. Right. You're so welcome. Great news. Doris has been like trying to get signed up somewhere. So Wow, that's really good news. Hey, and that's a tip for all of you watching too. It sounds like they were supposed to have them by February 11th, but that's tomorrow. So try the pharmacy list. If you guys don't know where that is, it's right over on AZDHS, and it's got all the lists of pharmacies. And I do want to remind you, remember a couple days ago, Garrett and I saw in there a couple pharmacies had 65 plus, not just 75 plus.
A
So
couple of them, they were there, and
yeah.
someone report back to us and let us know if
Yeah, let us know. Let us know.
That would be
Okay,
interesting.
so yeah, be a vaccine hunter for us, as we
Yeah.
talked about earlier. We're gonna have to do a little bit more on that. That's just too funny. I'm serious. If you didn't see the Jimmy Kimmel segment on it last night, you got to go back and watch.
I'm gonna have to find it now.
I'm a nurse. I'm a firefighter. It was good fun. Okay. So where can you find us? Where can you see that map? If it's updated in yellow, you can find all our very latest reporting on abc15.com/coronavirus. Garrett's Twitter account is at Garrett_Archer. If we see any yellow on that map, we'll celebrate it with you there tomorrow. And also on my Twitter account, which is at Katie Ramblett, or on my Facebook page at facebook.com/news from Katie. See, I'm telling you what, and I got a giant coffee today too. I don't know. So celebrating 1 millionth vaccine dose given out here in Arizona will continue to help you find the things to celebrate as we make our way through this crazy virus and over a year of tracking it now. But in the meantime, we'll see you back next week. Remember, be safe out there.